Welcome to Fundamentals of Nursing. This is Professor Capron, and today we're going to talk about glucose testing. You can find this information in your ATI Fundamentals book in Chapter 52, or in your Taylor's Fundamentals of Nursing book in Chapter 37. Blood glucose testing is a vital skill in nursing, especially for managing clients who have diabetes mellitus. So let's break down why monitoring blood glucose levels is so important and how it can be done effectively. Blood glucose testing is integral in managing diabetes mellitus. Diabetes is a condition where the body cannot regulate blood sugar levels properly. So, monitoring these levels helps in making crucial decisions regarding diet, physical activity, and medication. By regularly checking blood glucose, healthcare providers can adjust treatment plans to maintain blood sugar levels within a target range. This is essential to prevent the complications that are associated with both high blood sugar levels or hyperglycemia and low blood sugar levels or hypoglycemia. The preferred method for testing blood glucose is the glucometer. This is a small and portable device. It's the most common method for blood glucose testing. It provides quick and accurate measurements of blood glucose levels. Glucometers are highly accurate. They work by analyzing a small drop of blood, usually taken from the fingertip. Within seconds, the device displays the blood glucose level, providing instant feedback to the user. When you place a drop of blood on the test strip, the glucometer uses a chemical reaction to measure the amount of glucose that's in the blood. This reaction generates a small electrical current, which the glucometer reads and then translates into a glucose level. For clients with diabetes, frequent blood glucose monitoring using a glucometer is part of daily life. It helps them to understand how different foods, activities, and medications affect their blood sugar levels. We can also check blood glucose using urine testing. We will go into that a little later in this presentation. It is not as effectively used nor used as routinely as using a glucometer. Understanding blood glucose testing is crucial for nurses. Remember, it's not just about the numbers, it's about interpreting these numbers to help make informed decisions about a client's care. And you're going to be helping clients learn how to use glucometers, learn how to interpret the results, and you're going to advise them on actions based on these numbers. In diabetes, the body either doesn't produce enough insulin, that's type 1, or cannot effectively use the insulin that it does produce, type 2. Insulin is the hormone that regulates blood sugar levels. Regular glucose testing helps in monitoring and adjusting insulin doses and dietary choices. For someone with diabetes mellitus, maintaining blood glucose levels within a target range is critical to prevent complications such as nerve damage, kidney problems, and cardiovascular disease. Regular testing can inform us as to whether the treatment plan is effective or needs adjustments. But there are some other conditions that require us to do blood glucose monitoring. Let's look at a few of those. First, let's look at pancreatitis. The pancreas plays a crucial role in insulin production. In pancreatitis, or inflammation of the pancreas, its ability to regulate blood sugar can be impaired, necessitating glucose monitoring. Cushing syndrome is a condition that involves high levels of cortisol. This hormone can increase blood sugar levels. Regular testing helps to manage glucose levels in patients who have Cushing syndrome. Hypothyroidism is also a condition where we need to check it. Thyroid hormones affect metabolism. So, hypothyroidism or low thyroid hormone levels can slow metabolic processes, influencing blood sugar levels. Liver disease is another condition we need to look at carefully. The liver is key in storing and releasing glucose. So, liver diseases can disrupt these processes and lead to fluctuations in blood sugar levels. Patients who are receiving enteral tube feeding or parenteral IV feeding nutrition often need blood glucose monitoring, as these feeding methods can significantly impact blood glucose levels. Also, patients who are taking corticosteroids. These medications can increase blood sugar levels, making regular monitoring important for patients taking them. As future nurses, understanding these indications for blood glucose testing allows you to provide comprehensive care. Remember, again, it's not about the numbers, but about how these numbers reflect a patient's overall health and the effectiveness of their treatment. Before we conduct a blood glucose test, there are several steps we have to take, and these are crucial to ensure accurate results and patient safety. So let's look at them. First, we need to check the client's records. We need to look at the frequency and type of test required because different patients may have varying testing schedules based on their condition and treatment plan. For example, a patient with type 1 diabetes might need to test their blood sugar more frequently than someone with type 2 diabetes. We need to review any previous results. This will help us to identify any trends or patterns in the patient's blood glucose levels, which can help to inform adjustments in their treatment. Understanding previous actions taken, like any insulin adjustments in response to blood glucose levels, can also help us to guide current and future care decisions. We need to review the patient's medications. Some medications can significantly affect blood glucose levels. For example, corticosteroids can raise blood sugar levels, while some antipsychotics can either increase or decrease them. Knowing a patient's medication regimen helps us to interpret their blood glucose readings and can indicate if medication adjustments might be needed. Then we need to prepare the equipment. We need to gather any necessary supplies like a blood glucose meter, test strips that are compatible with that meter, an antiseptic swab for cleaning the finger, gloves for infection control, a lancet for pricking the finger, and a cotton ball for after the puncture. Using test strips that are compatible with the blood glucose meter is essential for accurate readings. Incompatible strips can lead to erroneous results. Finally, we need to prepare the client. We need to prepare them by informing them about what to expect during the test. This can help to ease anxiety and ensure cooperation. We do need to explain how the lancet will be used and how the meter works. We need to check the site we intend to use for skin integrity and circulation. Avoid using areas that have bruising, lesions, or poor circulation, as these can affect the accuracy of the reading or cause discomfort. So remember, proper preparation before conducting a blood glucose test is essential. Now let's look at the actual steps of blood glucose testing. Remember, precision and technique are key. We're going to select and prepare the puncture site, collect the blood sample, and use the meter to get a reading. So, why do we use the fingertip? Well, we use it for blood collection due to its rich blood supply. This ensures a sample that accurately reflects current blood glucose levels. Capillary blood from fingertips reacts quickly to changes in glucose levels, making it ideal for testing. Now, cleanliness is crucial. We need to avoid infection and contamination. So, wash the area with soap and water or use an antiseptic swab. Now, you need to know that latest evidence based practice says that we should avoid alcohol swabs as they can affect the accuracy of the reading. The alcohol may lead to sample contamination, and this can result in the denaturation of the enzyme that's used in some measurement methods. Disinfection solution can also dilute the sample, which would also diminish the final result. Alcohol concentrations of blood in vitro caused inaccuracies in reagent strip blood glucose readings. The errors varied depending on the type of meter, and they decreased with reflectance meters and increased with a pen. In practice, however, swabbing with an alcohol swab prior to testing had no effect on meter accuracy in the clinical setting. So I need you to understand that per ATI, you should not be using an alcohol swab for blood glucose checks. However, you will see this as a widespread practice in the clinical setting. Now let's talk about sample collection because technique matters. When you're using the lancet, sterility is essential. Use the lancet once to puncture the skin and then discard it safely in the sharps container. The lancet should be perpendicular to the finger to ensure a quick, clean puncture that produces enough blood with minimal discomfort. The first blood drop can contain tissue fluids, potentially diluting the sample, so wipe it away gently to get a pure blood sample for testing. Now we're going to squeeze the finger to get a second drop of blood. Gently bring the test strip to the blood. The strip should absorb the blood without pressing against the skin, as can lead to inaccurate readings. Now this is a gentle squeeze. Do not milk the finger, and we'll talk about that in lab. Now you need to make sure that the test strip has been inserted into the glucometer appropriately. Ensure the meter is calibrated correctly for accurate results. Modern glucometers require a very small sample and quickly display the glucose level. Record the glucose level as shown on the meter. This data is vital for managing the patient's condition because it guides treatment decisions and dietary recommendations. So, again, precision in technique and accuracy in recording are vital. Proper site preparation, correct sample collection, and keeping of the meter are crucial skills in blood glucose monitoring. There is one last step I'd like you to think about, and that's how to store the test strips. They must be stored properly to maintain their accuracy. Incorrect storage can lead to false readings. So store strips in their original container away from moisture, heat, and direct sunlight. Always check the expiration date before use. Improperly stored strips can produce very high or low readings. These incorrect readings can cause us to make treatment decisions that are not in the best interest of. Now let's talk about how to interpret blood glucose test results accurately. Understanding these readings is essential for effective diabetes management and for recognizing other metabolic conditions. Hyperglycemia is a condition characterized by higher than normal blood glucose levels. A casual or random blood glucose level greater than 200 milligrams per deciliter is indicative of hyperglycemia. Please be aware the patient does not need to fast before a random blood glucose level. A level greater than 200 milligrams per deciliter is significantly above the normal range. So this suggests that the body's insulin is not effectively regulating blood sugar. Fasting blood glucose levels are taken after a period of not eating, usually 8 hours, and are critical for diagnosing diabetes or prediabetes. A fasting blood glucose level less than 100 milligrams per deciliter is considered normal. Prediabetes is indicated by levels that go from 100 to 125 milligrams per deciliter, while diabetes is diagnosed at levels of 126 milligrams per deciliter or higher on two separate occasions. Persistent hyperglycemia can lead to severe health complications like diabetic ketoacidosis, nerve damage, and cardiovascular diseases. It's a critical flag for clinicians to adjust medication or dietary plans for diabetic patients. Hypoglycemia, on the other hand, refers to blood sugar levels that are too low, typically below 70 milligrams per deciliter. Hypoglycemia can cause symptoms such as shakiness, confusion, and in severe cases, loss of consciousness. It's particularly dangerous for diabetic patients using insulin or certain diabetes medications. Treating hypoglycemia involves a quick administration of fast acting carbohydrates. This can be a glucose gel, glucose tablets, or some kind of juice, for example, to raise blood sugar levels. For your patients who are taking juice or are otherwise able to swallow, giving them some kind of protein to go along with their fast acting carbohydrate can help to prevent rebound hypoglycemia, where the blood sugar spikes up high and then comes crashing right back down again. So it's important to correctly interpret blood glucose levels, whether they're random, fasting, or done after meals. And this is vital to manage diabetes and other related health conditions. Now let's discuss urine glucose testing. I want you to remember that it has limited effectiveness and indications, so understanding when and why to use this test is important. You need to understand that the kidneys typically reabsorb glucose from the urine back into the bloodstream. But when blood glucose levels exceed about 220 milligrams per deciliter, the kidneys can't reabsorb all of the glucose, and this leads to its appearance in the urine. This level, 220 milligrams per deciliter, is known as the renal threshold for glucose. It's the point at which the kidneys begin to excrete glucose into the urine. Now, this threshold can vary slightly among individuals, but it's generally right around 220 milligrams per deciliter. Urine glucose testing, therefore, becomes effective only when blood glucose levels are significantly elevated. It's not a sensitive method for detecting mild or moderate increases in blood glucose. Although limited, urine glucose testing is still occasionally used in the management of diabetes mellitus because it's a simple, non invasive way to check for extremely high blood sugar levels. Urine glucose testing can also help to identify conditions like gestational diabetes. Gestational diabetes is a type of diabetes mellitus that develops during pregnancy and usually resolves after delivery. So it's important that as a future nurse, you understand both the limitations and appropriate indications for urine glucose testing. It's a tool, it can provide additional information, but it should not be solely relied upon for diabetes management. Remember that blood glucose testing provides a more accurate and timely picture of glycemic control. But urine glucose testing can serve as an additional tool, particularly in resource limited settings or specific clinical scenarios. It can also be used as an initial screening for patients who are having routine urinalysis and can indicate which patients might need further testing to determine possible issues. This is the last part of our lesson, and we're going to explore the urine testing procedure for glucose. It's a simple but important tool in monitoring certain health conditions. So first, it's important to ensure that the client is physically able to provide a urine sample. This includes checking for any conditions that might hinder urination, such as urinary retention or incontinence. The materials needed for urine glucose testing include a clean urine specimen cup, chemical reagent strips that are specifically for glucose testing, clean gloves, and possibly a towelette or soap and washcloth for the client so that they can clean their genital area before urination. Proper preparation and cleanliness are key to obtaining an uncontaminated sample, and this is crucial for accurate test results. Assist the client in collecting the urine sample. This might involve helping them to the bathroom or providing a bedpan if they're bedbound. Once a sample is collected, the next step is to dip a reagent strip into the urine. These strips are treated with chemicals that react and change color when glucose is present. It's very important to follow the manufacturer's instructions for the reagent strips, including the time that the strip should remain in the urine and the time from being dipped in the urine until when you can read the result. This ensures the accuracy of the test results. Normally, there should be no glucose present in the urine. The absence of glucose indicates that the body's blood glucose levels are within a normal range, or at least not a super high range, and that the kidneys are functioning properly. If glucose is detected in the urine, it can indicate high blood sugar levels, suggesting the need for further investigation or monitoring. Remember, glucose will only appear in the urine if blood levels are quite high above the renal threshold. So, the presence of glucose in the urine is a sign of uncontrolled diabetes and requires medical attention. It can be a sign of other conditions, however, such as those that affect the kidney's ability to reabsorb multiple substances, not just glucose. So, understanding the correct procedure for urine glucose testing and how to interpret the results is an important skill for nursing students. Even though the test has limited uses, it still provides valuable information about a patient's metabolic status and kidney function.